Right, so thank you everyone for joining us. I think we're going to start and people can join us as we go along our journey today. This is the fourth in our 8-part series looking at the future of payments in South Africa and looking specifically at government-to-person payments and person-to-government payments. But really it is about how we start to digitize payments in the public sector. And the benefits of digitizing payments in the public sector is that it has a spillover into the private sector as well. And so we're really looking at what the huge benefits are of digitization of payments more generally. As I said, this is our fourth webinar that we're having. As you know, they're every 2 weeks. This specific webinar is actually called X in terms of like processing payments. So certainly we're interested in trying to explore data interoperability. And there's a very nice quote from Linda Sanford that says, the e-business infrastructure is built upon a variety of applications running from different platforms across different networking protocols, and they all need to share data. Universal access to data is a quantum leap towards the industry's goal of interoperability. And I think that really is the key of what underpins the way the public sector uses information and how we share information across the public and the private sector, and how the private sector actually uses information as well. So with that in mind, if we can just pull up the agenda, thank you very much, Marcel. You'll actually see we're going to start off with a reflection session, and that's really taking stock of the presentation so far. Remember, the intention is to kind of work towards something that we can actually use and move forward as a country in terms of the digitization and automation of payments more specifically. So there are two real issues that we're going to be covering in this, and if you have any questions, please pop them in the chat and we'll definitely ask our experts to address them. So the first is, what are the big issues that have come out of the session so far specifically? And then the second question is, what should the future system of payments, a digitized payment system, look like? And there we're actually going to ask our experts to think about what some of the most important design features are, or components of a strategy on government-to-person payments, on G2PX, when you're digitizing payments. So with that, we've actually got a variety of guests with us. We've got Julián Casal from the World Bank, who is a senior financial sector economist and specializes in payments. He's actually led technical analyses on the design and investment operations to promote financial inclusion. We've also got Chris Hamilton with us. Chris is at Hamilton Platform and a strategic advisor on the national payments infrastructure, or national financial infrastructure. He was also CEO at Bangserve Africa not so long ago. Jason Wang will be joining us from the Payments Association of South Africa. He's a strategist and payment specialist at PASA. We've also got, sorry, I'm going in a different order, aren't I? We've got Fanie Sethoga with us. He's from SASSA. And Fanie has basically headed up the grants administration portfolio at SASSA since May 2020. He is a general manager there. Then we've got Harish with us. I'm hoping that this is in the right order, who's also the head of global payments and the lead financial sector specialist on payments and market infrastructure at the World Bank specifically. And you'll recall Harish actually presented right at the beginning of the webinar series when we joined. We've got Sheirin with us. I think it's actually Georgina. Let me go there. Thanks. So we've got Georgina with us, who's a program officer and specifically focuses on G2PX, and she's also presented with us before. And we've also got Sheirin with us, who is also a senior financial sector specialist focusing on payments specifically. It's actually, I should have sort of stuck to it in alphabetical order. But I do have my own order in my head because these are focusing on questions 1 and 2. So that's my order. So essentially, Sheirin has actually been instrumental together with Julián and Claudia Meek in trying to pull this webinar series together with us. So she's played quite an instrumental role in designing the program with us. And so we're very grateful to Julián and Claudia for actually introducing us to Sheirin and for all of the work that Sheirin has been doing. So a special thank you to Sheirin as well. And then finally, but not least, we've got Metz. And Fanie has been brought in because she actually is the program officer on the World Bank's Identification for Development program, working in a couple of countries, well, actually working in many countries in Africa and Asia, focusing on digital identification systems specifically. So we're trying to address some of the core issues with the team and the panel of experts that we actually have. So Julián, I'm actually going to start with you. And so you've actually attended most of our payments, if not all of them, and you've heard a series of discussions around the digitization and automation of payments and that. So my question to you is, having heard everything, you know, that has been presented and the various case studies and that, what are the key themes that have emerged for you that would be relevant for South Africa going forward?
Thank you very much, Kathy. It's a pleasure to be here with all of you. First, I want to start thanking the government of South Africa for having organized such a rich and engaging series of webinars on such a timely issue. In particular, I'd like to thank Saul Musker and the Project Management Office of the South African Presidency for having convened these, and you, Kathy, for having done such excellent job chairing all of these sessions and such expert stewardship of all of these seminars. I also really want to thank the government's representatives that we had from the governments of Turkey and India, who presented their experience on whole of government approach to digitizing GDP in the opening session, as well as colleagues from the World Bank and CGAP, as well as our donor partners, who presented a number of international experiences and also country case studies from Bangladesh and Indonesia. For the World Bank, improving government to person and person to government payments is very important and a central part of our engagement in South Africa, where we work very closely with the National Treasury and financial sector regulators on promoting and supporting financial sector development and reform. From these seminars and series, which I've had the pleasure and privilege to attend most of, there are three key themes that emerged to me that I wanted to share with you, and I'd also be interested in hearing from the other panelists. The first to me is that there's no such thing as a one-size-fits-all approach to this digitization journey. Each country will need to find what suits them, their needs best, and is also tailored to their unique characteristics. I think the cross-country comparisons have been very useful, and the international trends that have been highlighted by colleagues have been very insightful, but I'm still eager to hear much more about specific initiatives that could be appropriate for South Africa and what some of those tailored programs could be. Second, and linked to this first observation, there are some common themes that have come across, particularly from the presentations from other jurisdictions. One is that this is much broader than just payments. I know that the organization of this has been around G2P and P2G, but I think that perhaps we would need to broaden our view a little bit and talk not just about interoperability of financial service providers or standardization of technical specifications, but also look at how government can facilitate this and also share information and data between different government agencies and databases, which I think is the topic for today's session, which I'm really looking forward to. Also, while a digital-first approach can be very helpful for scaling the delivery of public services, I think we also need to be mindful that in many of our countries, there are segments of our populations that are going to be difficult to reach, that live in remote areas where a digital-only approach won't necessarily bring them best services. Lastly, and I'll end with this, I think it's critical, and you and I have discussed this, Kathy, in the past, I think it's critical that there be a champion for a lot of the different initiatives and reforms that are underway. At the moment, there are fascinating experiences and initiatives, but there's also a very diverse ecosystem with a number of different stakeholders, and bringing them all together to achieve consensus and develop a common vision for the digital development in South Africa is a large undertaking. And so we would hope that a champion could emerge that could help bring together those different aspects and help overcome perhaps some of the fragmentation that we've seen, in order to be able to achieve more of a developmental impact. Thank you so much.
Thanks, Julián. I mean, that's very useful and very insightful, actually. Moving on to the same question, really, Fanie, from a SASSA perspective, I mean, you've attended and also responded to quite a few of these sessions as well. I mean, what has really stood out for you that is relevant from a SASSA perspective? And I mean, I know you've raised some like digital identity, but it would be good to hear your viewpoints, also reflecting a little on what Julián has said. Thanks, Fanie.
No, thanks a lot, Kathy, and good afternoon to everyone. I think just to indicate in general terms, Kathy, there is a few elements. If I was to indicate that from a government's perspective, there is huge potential in digitizing government to persons payments. And this is from a perspective of lessons learned during the COVID-19 pandemic. I think I'd seen a number of entities running around trying to make ends meet. People having been identified, but how those people could be paid being a challenge. Banks not being able to receive clients because they had the same crisis as the rest of the country and the rest of the world in terms of managing risk exposure. But otherwise, in the case of South Africa, to be specific, government to persons payments, I must be honest, can lower disbursement costs drastically. I think you would agree with me that it is a fact that we spend much money on cash management or on cash logistics management, security, and all of those things. There is a need for government to provide some leadership, specifically from a perspective of regulatory reviews. I think there is a number of, from some of the cases that we've had, some of the elements that have been provided in there would require, from where I'm seated, our government may need to jump in and provide some regulatory guidance. The rest of the stakeholders involved with a payment value chain, I think it goes without saying, from the case of Bangladesh, India, the Turkish example, there is a need for the ecosystem to be reviewed, increase or review the access points in this particular instance. And for that purpose, the ability to digitally verify and authenticate beneficiaries has come very, very strong. The use of standards and design principles that allow for interoperability, we've had them coming very much strong. I think the majority of those case studies, one of the things which they were not suggesting was that the relationship between the different entities and banks, it will always be there. But I think some of those case studies had left a hole that seek to say that how do we involve the fintechs into the whole picture. But of course, digital ID came very strong. Biometric payments and biometric authentication was quite strong. The one that I liked a lot, which was cited by India, and I think Indonesia touched on it, was the ability for us to be able to transact offline. I think those are some of the key takeaways that I was able to grab. Thanks a lot.
Super, thanks so much, Fanie. That was great. Chris, over to you. Your perspectives on what you've heard and how important that becomes for digitizing payments and what the impact or benefits of these of automation and digitization would actually be.
Thanks, Kathy. So I'm coming at this from a more private sector perspective than probably many of our speakers, because my background is in helping the private sector coordinate to deliver payments infrastructure. And obviously that's got a very strong resonance with what the government does in terms of delivering a really excellent government to person and person to government payments. And those two things dovetail very strongly. And so I do have some sort of general conclusions about how we might move forward. And I wanted to focus on that to try and make this quite practical. I mean, the first thing to state the obvious is there's a strong case for a thoroughgoing review and reform of government payments, which is not to say there hasn't been great work done in the past, but that a holistic approach could yield really big dividends here. And we've heard that very eloquently from the World Bank with their message about integration across different benefit delivery programs, with the case studies that we've seen from different countries like India and Bangladesh and Turkey and so forth. So, the business case kind of writes itself, but what we need to do, though, is be very practical about where the wins are and not expect to get them all at the same time, right? There are some efficiency gains that we could get very quickly, but if that's as far as we get, then we miss out on some potentially much bigger ticket wins for the community, like financial inclusion, like empowering the individual citizen with more control over their own data and more control over their own payments. And those kinds of things, while they're hard to deliver, are much bigger wins, it seems to me, than saving the government significant amounts of money, although that's good as well. So we need to really think carefully about prioritizing drivers in terms of where we want to get to, and perhaps road mapping them and saying we're doing this year and that in 2 years' time. Thinking that through at a holistic level would be wonderful, and involving the private sector in that. Look, the second key message is we really have to think ecosystem, not delivery system. And I mean something quite specific. Ecosystem gets thrown around a lot, but we are talking about the way value circulates in the community. We're not just talking about delivery of benefits to citizens. We can do so much to improve the lot of citizens if we seamlessly integrate those two things together and think about the whole ecosystem. The two things that make ecosystem distinctive is one is that they are organic in the way they evolve and change. So within a framework that is set and led by government, all sorts of good things can happen which are not done by government because that framework is there and people can build on it and evolve and develop. And we wouldn't need to be thinking that way. We're not doing a big project to deliver a system and then we're done. We're setting up some big stakes in the ground so that the economy can evolve around them. And if we can think about it that way, I think we'll get further. And then the other thing is that at a holistic level, you need to be clear on some really big ticket decisions quite early on so that evolution can happen. All ecosystems in the payments world consist of, I think of it as 4 Ps. There are providers, pools, platforms, and people. And we need to set some hard variables across some of those 4 things and say, for example, we're going to have a single ID system run in a certain way for the digital world in South Africa. And if you set that really clearly and can communicate it to the private sector, you've then created a stake in the ground around which a lot of other good things can happen. But until you get that stake in the ground, people will be going off in different directions and will struggle to make progress. So one of the big agenda items, I think, for the next little while is what are those big stakes in the ground that we're saying are fixed? We're going to use this ID system or this way of doing ID. We are going to use faster payments, for example, as a stake in the ground. It's been agreed, the government is supportive, the industry's built it, it's in test mode now. That's a great resource. How are we going to use that? And then if it's the case that there will be a CBDC, for example, at some stage in the future, when you think about what that means for this world, that can be 5 years out. It's okay if it's 5 years out, but we still need to be clear that it's out there and that it's eventually coming towards us. And then look, the other thing is we need to be really clear on the appetite for risk here. The bigger and more ambitious your projects get, of course, the higher the risk and cost. And if we're, getting a whole of government initiative to work is hard enough, but getting a whole of ecosystem initiative to work is even harder. We need to pick off the manageable bits of lower risk items that lead us towards the bigger path and have an evolutionary path in that way. So this is a really exciting development. I think, lots of congratulations due to the organisers of this. I think there's great potential here to do some real good for South Africa. And I'm really excited to see the strategy evolving as we go forward. Thanks very much.
Thanks so much, Chris. That's very useful and actually very helpful in guiding us as we map the way forward. Jason, your reflections, you've always been pretty vocal in our sessions. So your perspectives and views of the issues that have emerged and what is important going forward. So having listened to Chris, perhaps some comments on that.
Thank you, Kathy. Yeah, I think there was something from the observations which I've picked up through the sessions, firstly around that bigger picture, and I'm glad you kicked off almost that beyond government payments. And to me, there's a consideration just beyond government to person. There's almost this thinking we need to look at this holistically, and I think Chris mentioned that, around what is the end-to-end value chain. And we're talking about not just the payment aspect, but also from the registration to the receiving of the payment, but also to be able to make payments thereafter. So, and I think one of the examples that they were provided from the first session from Turkey and India really spoke to this thinking about e-government. The second thing was, for me, that resonated was around data integration, but data integration that also connected into other services. And to me, what really came out from there was also around the convenience aspect. So the integration, the usage of multiple channels, so that people, and there's the freedom of choice, I think, for customers to register, to access, and to use. The third thing, what I picked out was very interesting when some of the in one of the presentations, and through the examples around that was presented. For example, in Jordan, there's the introduction of Click. In Brazil, they have the big solution. And these are, when I look at this, and Bijnin presented on this, around how can we create a ecosystem or digital payment system that is cash-like as well, and I think that is something that is quite important. But what also came out from there was that technology is only part of the solution. Importantly, we have to look at it holistically, and we have to look at it from a social and behavioral perspective around how can we get people to also use that service. And this leads to my concluding observation around the collaboration. And I think all of the presentations was very interesting because they also looked at public and private partnership. And to me, that really spoke about how do we create the network effects to broaden access, to broaden usage. And in the previous presentation, the SARS presentation, it's also some of the initiatives that they were looking at also sparked other ideas of my thinking. Our solutions also need to consider alternatives. How do we partner with each other to broaden access? And I believe in the example that they provided, that they are looking into the partnership with other retailers, with banks and non-banks, in order to create a better access and usage. Thank you. That's, I think, some of the key things and big issues that I think are rising from the previous sessions.
Thanks so much, Jason. And I agree with you on the role of the public-private partnership, which kind of will spark development. So it's almost like we're putting a project beacon in place, and then that has to create these spillover effects. And I'm going to ask you to come in and tell us a little bit about about digital identity and its link to payments specifically, and how it helps promote financial inclusion, before I then ask the harder questions. And Harish, there's a question for you that I'm going to allocate to you, if that's okay, between you and Georgina. If you can also look at the question in the chat. So over to you, Anna, before I hand over to Harish.
Thank you, Kathy. And I also want to say I'm a newcomer to this session, so hopefully what I'm saying will tie in nicely with what was heard before. So I think digital ID can have an important role across the payments delivery cycle or the payments delivery ecosystem, from making the programs that are delivering services or delivering payments more efficient, to supporting financial inclusion, making it easier to open bank accounts, as well as at the end of the chain in terms of strengthening authentication mechanisms for cash out and for financial transactions. In terms of the efficiency of programs and the efficiency of program administration, where you have a common, where you can use the ID as a common reference, as a unique kind of identifier across different programs. We have seen from many countries in the world, in Latin America, in Chile, in Argentina, as well as in countries like India or Pakistan, that this can really be a powerful tool to clean databases, to ensure that, to verify eligibility, to make sure that the programs are run efficiently. And also, I think during COVID, we have seen that where you have a digital ID and you are able to verify identities remotely, then you can also start thinking about things like remote onboarding of people and still have the same high level of assurance that you would do in person. And of course, on the second point, the financial inclusion side, on the account opening side, where kind of countries have been able to leverage their ID systems and link them to the systems of financial service providers, the account opening process would be greatly streamlined. This is something, for example, in India that has come out very clearly, where the KYC process, the cost of the KYC process went down from something like 60 cents to 6 cents. So it's really has broad benefits for the financial service providers, but also these were then passed on to the actual customers, the beneficiaries, who were able to open accounts with a lot less hassle, with a lot fewer documents. So really helping with that side of the financial inclusion and the payment digitization agenda as well. And here also, I think increasingly we're seeing innovation on the non-face-to-face account opening side, and countries and financial service providers being able to leverage the ID systems to onboard people remotely. And I think this is the next frontier. And also on the authentication at the time of cash out or financial transaction side, the ID system can play a role in making sure that the person who is receiving the payment is really the person who this payment was intended to. So here again, we can think of biometric authentication, whether that's pinging the ID database, whether that's using a chip on a smart card, or also kind of financial service providers can also then build on these assets and think about issuing their own credentials or their own kind of additional authentication methods building on the ID. And so I think maybe one more important point to make across all of this is that to make this happen, you really need to have both kind of the infrastructure and the frameworks, the policies to enable data sharing between the ID system and different program registries, between the ID system and the systems of financial service providers, between the ID system and the payment system. So that's, to me, kind of one challenge that it seems to have come out from past discussions, that's a missing link, and that's something that's where a lot of work still needs to be done. And that said, I think that South Africa's foundations in terms of the ID are quite robust. There is a high coverage system. The system already has digital capabilities. So there is a lot of good existing assets to build on. Thank you.
Super, that's very, very useful and very exciting. So actually it was spot on, by the way. Harish, moving on to you, and I know you've also worked on digital identity and linked it to payments and things like that. I mean, from a G2PX or digitizing of payments, what do you think are probably the key features, components, or strategy to unlock the digitization of payments more broadly? And then also the question that Bhavanesh proposed, presented, which I think is a very interesting question, to see where non-government actors have actually started to create sort of like digital migration into ecosystems, forcing government's hand. So if you can address those, thanks, Harish.
Thank you. So I think Anna already talked quite a bit about the linkage quite eloquently, and I think just to highlight a few points. First of all, I think identification certainly helps in bringing more people into the financial system by addressing some of the know your customer and other challenges, making the process more efficient. So I think that has a general effect on the overall financial sector, which has knock-on implications for the delivery systems, as Chris was mentioning. The other point is that it also potentially enables new payment options, potentially, right? For certain contexts where it might not have been possible earlier to authenticate people who might not be able to, who might have literacy challenges, numeracy, being able to remember numbers and things like that. I think for them, this might provide an alternative. And then I think this whole deduplication and ensuring the integrity of the overall program, I think that's also an area where it helps. But at the same time, there have also been cases where this tighter integration between the ID and the payments has become actually a problem, because that kind of forces people into a payment instrument which is not mainstream. So it gets integrated so closely that this can only be used for withdrawing the social benefit transfer. So I think that can be something one has to watch out for. So I think at the right points, using the ID infrastructure for authentication makes sense. But if that is the main authentication instrument, whereas the other payment streams in the country do not use it, then I think it might be counterproductive for the broader objectives. So I think that's what I would perhaps leave it. There is also, of course, this notion that once you have good functioning ID systems, and if they are well integrated into all the other government systems, then this whole data integration becomes easier, and then that process becomes easier. And also, it's easier for the customer to give consent, etc. Right? So I think there are implications there. Now, in terms of the question from Bhavnesh, so I don't know whether he has any there was a subtle hint in the question, whether he was alluding to something, but in general, I think speaking broadly in terms of digital payments, I think certainly the private sector has always challenged the government in terms of what is possible and what is feasible. And there are a number of examples, including in South Africa. There are issues in the private sector which has really kind of encouraged the government to see what can be done, what more can be done. And then you have the traditional examples we could give of Kenya. There are examples of India, Bangladesh, etc., where some of these things actually originated in the private sector. But when it comes to government payments, whatever might happen on the private sector doesn't automatically translate into better efficiency gains and better experiences for the recipients, because there's a very clear government decision required to allow those innovations to be incorporated into the overall government payments framework, right? And that is where I think, as a lot of speakers are emphasizing, as Jason was mentioning, Chris was mentioning, and then also Fanie was mentioning, I think this whole public-private partnership becomes very, 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 very important. And then one final point from my side, and I'm happy to come in at later points. In an ideal world, you do not want government payments to be seen as a separate payment stream, right? So there's a general overarching national payment systems framework. There are different systems and there are different needs of individuals. And you need to come to a point where the social protection agencies and the government doesn't really have to worry about how do I get the payment to the person, and they should be rather worrying about how do I design the program, how do I decide who to enroll, and what are the general terms and parameters of the program, and take the payment part as a given, right? And simply plug into that. I think that is what is an ideal state, and I think that's where we need to go. But of course, to get to that, there are a number of things to be done, and we need to have the right strategy, the right tactics, and then also be kind of very deliberate and methodical about it. So let me stop here, and I'm happy to come in later on. Thank you.
Super, Chris, I have seen your comment. We are going to defer it to our chat at the end, if that's okay with you. I just want to get to the next two speakers very briefly so that Nala can present on Egypt, just because she has to leave at 3. So we've got a time constraint, but we'll definitely pick it up. Georgina, in terms of your perspectives as well, I mean, building on what Harish has actually said as well, some of your thoughts on what the key design features or strategies are for unlocking and promoting the digitization of payments, and maybe where the future of payments is going. So things like CBDC that Chris mentioned, and other payments, you know, through WhatsApp Pay, etc.
Thank you very much, Kathy. And it's a pleasure to be back in this workshop series. So I would like to echo what has been mentioned several times by Jason, Chris, Harish, and others on the importance of the development of the ecosystem, and not only the payment delivery system for G2P payments in particular. And I think one of the biggest elements when thinking about what the G2P architecture should be for South Africa in the future should be asking the question on how can we create a better experience for recipients, and how can we really place that convenience and those efficiency gains, not only with the government, but also thinking about the recipient itself. And I think that's where the idea of potentially providing choice for beneficiaries and creating that ecosystem that is conducive to a full financial inclusion experience, where an account is really a gateway to other financial services such as payments, savings, and transactions between persons that can create value to the person becomes really important. And for that to happen, we definitely need the ecosystem to develop in parallel with the payment digitization, and for the approach on the government payment digitization to take into account the different barriers and the different levels of development in the country, and of the characteristics of the beneficiaries when deciding which accounts to use, which payment service providers to bring into the platform, and eventually with the idea of moving to an ideal, like Harish was saying, where you just rely on the financial system and the national payment system to deliver this, and the social assistance programs can just think about their core business, which is selecting beneficiaries and making sure that they receive the support they need. Thank you.
Super, thanks so much. I agree. You know, payments are a back office function, and they should actually happen seamlessly on the back end. Sheirin, any comments from you? I mean, you've actually been, so you could actually respond to either the first or the second question, because you've actually attended all of our sessions and helped design it. So maybe some things that have stood out for you, and you've also worked in South Africa.
Yeah, great. I just want to say thanks to all of our discussants today. Thanks to the organizers. This is really rich. You know, we've seen so many topics covered, so I think I'll just break us home so we can get over to Nala. You know, what I'd like to emphasize right now is, I think what we all know, and apologies for the light, the sun is just rising stronger in Washington, DC, and can't dash over to close my window. But, you know, we're at this unique moment of in the G2P payment ecosystem with COVID, where we have had such a wide broadening of programs in a rapid way. You know, that of course kickstarted this webinar series to want to see that this is a moment of opportunity. We've seen the pain points that have happened in trying to rapidly deploy new government payments. But you know, we've started off seeing what's possible from different country cases, and heard about the advantages, the cases there. So really, we know that there are, from speaking with different actors in both the private and public sector in this ecosystem, we know that steps to digitization are there. So really, it's about coming together to work towards that overarching vision, that overarching framework, and how we can get started. We've also been able to talk to some of our country counterparts that have attended how they got started, looking at the entire ecosystem, building that working group, building that case. So I personally am excited. I know that it's possible to have such a national vision, and I hope that this webinar series can continue to build that case and that momentum with all of your helpful participation. Thanks.
Super, thanks, Sheirin. And we're definitely going to continue with this conversation, and we'll pick, Harish and Anna and Georgina's sort of, and Chris as well, on sort of opportunities for biometric verification and the different tools that are available, etc. Nala, over to you.
Thank you very much, Kathy, and thank you for actually inviting Egypt to make a presentation of the work that we are trying to do with the client. So I hope you can see my screen. I will try to make it bigger. So basically, you can see it. Thank you.
Yes.
So my presentation is more broadly about building a unified national registry more than payments. Of course, payments is one part of it, but actually since 2017, we have been working as the World Bank to support the government to build a unified national registry. The idea of a unified national registry was not new to the government. Since the 70s, the government was thinking of that, and we tried to actually document a case study of this idea of connecting government databases. But at the time, there was no unique ID. Only in 1996, Egypt created the national ID. It was a very big project, and now all Egyptians have a national ID. The work was led by the Ministry of Planning and the Ministry of Administrative Development. And when the bank started in 2017, only 10 databases were connected, and there was a problem of data sharing from other ministries, so that the Ministry of Planning were signing protocols for data sharing, but the ministries were not actually sharing the data. And that's an issue. Sharing data is something sometimes scary for even within the government in itself. But through the work of the bank, we've shared experience of other countries, Brazil, Chile, Argentina, Turkey, and we started to support the government. But actually also the mandate moved to another entity. Actually, it is a powerful entity. It's called the Administrative Control Authority. It's directly under the president. And only with that shift, the databases were starting to be shared even before signing the data protocols between the ministry, because ACA, the institution that is now running the UNR, is actually mandated. It's an independent anti-corruption authority that reports directly to the president. So by their bylaws, they have the right actually to see all the data and information of all the ministries, because they are an oversight body over the entire ministries. But after we started working with them to build the UNR, they actually established a unit. And this unit is basically a national project to build the unified national registry that has 3 subunits: a digital infrastructure unit, which is basically supporting government agencies to have servers and the government to government type of service bus, all the digital infrastructure that allows the interconnectivity between the different databases, and the digital transformation, so that actually the ministries are not using paper, that everything is digitized, and then using all this data and information for business intelligence and decision making. And this is the area where we at the bank, and especially the social protection team, are very interested, because they have a lot of information about citizens that can help to better target the programs. So right now, using the unique national ID, ACA was able to connect maybe 52 databases and create know your citizen type of profiles for 25 million families, which is the entire population. We are around 115 million individuals living, not entirely all living in Egypt. There's maybe 105 living in Egypt and maybe 10 million out of Egypt, but they have the data of all Egyptians, those that are in the country and those that are outside the country. Also, I want to let you know also that there's another database that is part of the UNR, but that is of great interest to us in the social protection program, which is the social registry, which is a database of the poor, because the Administrative Control Authority has the UNR that has all databases of all different government entities. One of those databases is the database of the cash transfer program that is called Takaful and Karama, that is led by the Ministry of Social Solidarity. So Takaful and Karama database has 31 million individuals that are registered. These are all the people that came and applied to the cash transfer program. They receive their cash payments every month from the post office. We have 400,000 post offices all over the country. So it's very accessible to all the poor in very remote villages and very remote areas. Right now, the Takaful and Karama digital card is being replaced with Misa card. And we think that this is a very good transition that the government is doing, because the Misa card can be used in any place that has like a visa machine. So also we've done this transition actually after COVID. Before that, it was a digital card with a PIN, but you can only do the payment, get the cash from the post office only. The system also has automated grievance and redress mechanism. So all the grievances that are received through the program are automated, and this also helps the government to get feedback on how the program is doing. And of course, it's the database, the social registry is directly connected to the UNR. So we're able to do the cross checks from the cash transfer program to the national ID and other parameters that I will explain a bit later. And we have social accountability committees that are also connected through the MIS system. As I mentioned, to date, the UNR has connected to over 52 databases, government databases, like the civil registry, civil administration, communication, education, taxation, pensions, of course, the cash transfer program. So what the Unified National Registry team are trying to do is to try to use the data coming, this administrative data that is coming from the 52 databases, to classify households into categories. And they've put 5 categories: upper class, middle, upper middle, lower middle, middle, vulnerable, and poor. Of course, this methodology is different than the cash transfer type of program methodology, which is a poverty targeted methodology, which is a proxy means test. But at the same time, we think that by reviewing this data, we're trying to validate actually this data from the bank side, but the data is very telling, and they are running a lot of simulations using artificial intelligence and looking at things, variables like if your children are in public or private school. This is a very important variable in Egypt, because if your children are in public school, you're probably poor, because public schools are free and the quality is not very good. So they put certain thresholds. So if your children are in private school over 30,000 pounds every year, then they would put you in a certain category. They look at telephone consumption, electricity consumption, car ownership. So there's lots of variables that they're using to reach this categorization. And we are right now working to validate the criteria that they have in place. Just to give some examples of how the UNR is being used actually up till now. So for example, it is used for the cash transfer program to check the ID, but also to check against other parameters. So we would run the PMT, but also we would look at land ownership, remittances, car ownership, or property ownership. And the way the Ministry of Social Solidarity is able to do that is by sending the IDs to the UNR team to do the cross checks. So this is one example of how the UNR is being used for the cash transfer program. Another area was the cleaning of the food subsidy program. So the food subsidy program was a very old program. What the UNR helped to do is actually to remove duplicates, deceased, because the program started in the 70s and some people were using card of deceased people. but also it was used to eliminate the very rich. And that was easy to do because they chose, for example, a single variable elimination. So if you have a very expensive car like a Jaguar or a Mercedes, and some people had these type of cars and had the food subsidy card. So like 2 million people were removed just using one single factor. The social housing program also sends the applications to the UNR, and they tell them the parameters that they would want to see, to be able to see who is eligible or not eligible for social housing. Also, they are now launching the universal health insurance program, and also based on the UNR data, they will decide who will be subsidized and who will not be subsidized. Of course, during COVID, there was a temporary cash assistance for irregular workers. People came in and applied because Egypt did not have a scheme to support irregular workers. And we got, the government got 4 million applications. And by running certain cross checks with the UNR, 2 million were found eligible. Of course, there's a very strong criteria of how they put the variables. So you could not be, for example, in Takaful and Karama and be also in the irregular workers. You cannot be part of the pension system and be in the irregular workers. And also the database of Takaful and Karama was used to increase the number of people getting the cash transfer program. So we've added 411,000 households. And of course, the Ministry of Social Solidarity continues to use the database, the poor database, to actually do other like cash plus type of interventions. Because the beauty of having these databases, especially when it's something done through a proxy means test like Takaful and Karama, you would know if a house has a roof, if they have flooring, if they have access to potable water, if they have a gas connection. So the project is now launching a number of cash plus interventions, and this like diagram is showing that the 30% is the 30% of the people that were found eligible from the 31 million household individuals. So 12 million were found eligible, and from those 12 million, we are doing other cash plus interventions such as the Forsa or Opportunity Program, which is the graduation program, economic inclusion program. The first 1,000 days targets mothers that are pregnant or lactating. The no illiteracy with Takaful, we have 64% of the mothers in the cash transfer program are illiterate. So there's an adult illiteracy eradication program. 2 is enough is something related to reproductive health. So all this is cash plus. It's the cash plus these other programs. On the other side, where you see the 100%, it means that even if you were not eligible in the Takaful and Karama cash payment, you still get these 3 other services. Of course, some very poor women did not have IDs, so you would provide them with an ID free of charge. And there's a program called Decent Living and Decent Housing, which relates to the infrastructure in the home and in the village that the village can all benefit from. Just to close, I just want to say that we are aware in terms of going forward that the Administrative Control Authority still needs to enhance the accuracy and the quality of the data. And we always caution them not to use administrative data to make big decisions before actually validating the data. And this is an exercise that we are doing actually with them right now, because I always say nothing ever replaces real field work and going down and taking a sample and doing some work. So this is what we're doing now. And we are validating also the 5 categorization from the rich all the way to the very poor. Also, another area that we've been working on for some time now is actually relates to the governance and the legal framework to govern the data, issues of data privacy, security, and so on. So we've been sharing best practices from other countries on data privacy and legal frameworks to govern the UNR. So let me stop here and back to you, Kathy.
Thank you very much, Nala. That's actually a fascinating presentation. And as Mark Bletcher, who is actually at the Treasury in charge of social development, has agreed that it's a very interesting presentation. I'm very mindful you have 3 minutes. I have 1 or 2 small questions for you very briefly. Just to clarify, the UNR is actually responsible for doing all the data mining and verification on behalf of various ministries to identify who qualifies. Is that correct?
No, let me explain. So the UNR basically is housing different databases from different ministries. So if the data coming from the original ministry has a problem, they can do cross checks to see the problem. So for example, they got the data of everybody that has a food subsidy card. They got that data from the Ministry of Supply. But they did some cross checks with the ID and found that some people are actually deceased because the Ministry of Supply doesn't have a link to the civil registry. So they get the data from the different ministries and they're able to do some sort of an accuracy and validation to an extent, of course, to a certain extent based on the cross data, the other cross data that they have.
But so the ministries themselves would actually say, can you verify the information for us? But they're actually checking it because they've stitched all the data together. Is that correct?
Yes.
Okay. And in terms of sort of governance and security, are they doing EKYC stuff as well and sort of cross-checking on corruption from a procurement perspective that you know, government officials are not benefiting from procurement contracts? Not really.
No, they are not looking into that. No,
okay,
not
so
yet.
From the procurement side, they've not really gone into how those payments are being processed. Super. Are there any other questions that I can, maybe somebody can raise a hand? Chris, have you got a question?
No, Kathy, I'm okay. It was a very interesting presentation. I'm trying to match it up with what I understand of the payments market in Egypt, which is a whole different ball of wax. But we can talk about that in the discussion session if you like.
Super. So if there are no more questions, if they do have questions for Nala, please put them in the chat and then we can actually email them to her and then respond to you directly if that is okay. Nala, thank you very much for your time. We really appreciate your, sorry. Marcel?
How are you?
Fine, and you? Thanks, Aaron.
Thanks, Aaron speaking, man. No, I really appreciate Natha's presentation regarding the experience in Egypt. Must mention that we are busy. We are on the process of trying to establish the Master Social Security Registry, which will be similar like the National Register as alluded by Natha. But just fast forward, I would love, Katie, if is it possible if I can have the Natha presentation for a benchmarking processes. Thank you.
Super. Now we will circulate that to everybody that has attended, Aaron. Nala, thank you very much for your time and for your presentation. It was really very insightful and very exciting work. So good luck, and then we'll definitely be catching up with you. Thank you so much.
Thank you very much, Kathy, for inviting me once again. I've made some small updates to my presentation, so I will send you right now my updated presentation. And sorry that I have to leave. Thank you.
Thank you. Thanks so much. Thanks so much, Nala. Karen, over to you. You presented to us 2 weeks ago and had a fascinating presentation on how SASSA has undertaken payments, especially in a COVID world or post-COVID world. So over to you, Karen, to actually present on some of the data interoperability issues.
Thank you, Kathy, and good afternoon, colleagues. I'm going to go directly to it, as I am sure that we are all pressed for time. So I'm going to just touch on what is data interoperability, lessons from the SRD 350 that we as SASSA has learned, and then also some recommendations on the way forward. Now, I think when most of us has seen this picture somewhere in the past, but if you look at this in terms of interoperability and you think about this, then it is messy. And your anxiety levels are heightened if you just look at this picture. I mean, it looks outdated. There are so many of these tracks. You're not sure which of these tracks are following where. Will you make it? So imagine you're a new agency that start out, you've got your trains, and now you need to navigate this thing. And there's also to the top of the picture old tracks that's just lying there. Nobody got rid of them, but they're still there. So I think especially for somebody that's got a bit of OCD like I do, this is like really a terrifying picture. And when we look at the interoperability within South Africa currently and what we have learned in the SRD space, it very much looks like this and something that you have to breach. So maybe just looking at what interoperability is, it's the design of things to work together. It's as easy as that. When we look at data interoperability, it addresses the ability of systems and services that create, exchange, and consume data to have clear shared expectations for the contents, context, and the meaning of that data. It's very straightforward. It's clear. I think we can all follow with it, and everybody that studied this, it's like really, very clear. And then the Protection of the Personal Information Act also governs the data collection, looking at the type of data, consent, legal aspects, the minimality of the data and the transparency that you collect. It looks at data access and accuracy. It must be correct, complete, and reliable. And then it looks at data usage and restrictions, the purpose of the data, the relevance thereof, the restrictions placed on it, legality, etc., etc. So when we look at this slide, it's clear, it's easy. How can it go wrong? There's nothing. It's if everybody just adheres to this, it shouldn't be any problem, or would it? So when we look at the specific context that we have in terms of SASSA, I just want to quickly remind everybody, this was a slide from the previous show as well. So what did SASSA look? SASSA wanted to look at getting hold of the informal industry and the unemployed at that stage. And what we did is we looked at the Department of Home Affairs database for all citizens, excluded under 18 years and excluded 60 and above, as they will both qualify then for normal social grants. We looked at active grant recipients and we excluded them, people that's in correctional services. We were supposed to look at government institutions, people in government institutions like DSD. We got data from NSFAS. We did not interface yet with COIDAR, RAF, and others in that space. We have interfaces with the UIF. Also, then we looked at other COVID assistance like farmers, sportsmen, etc. And then we also interfaced with partial, and the government employee pension fund. Municipalities and agencies we are not interfacing with at this stage. And then we are also interfacing with SARS specific to the SARS IRP5 database. So this is basically the databases that we are looking at and that we wanted to touch and those that we have not touched yet. So when we look at what we had to do, I think the grant highlighted the need for integrated governance from a data perspective in South Africa. We fell in almost all of the POPIA pitfalls that it sets out. I think there was almost not one of those elements that we did not at some other stage touched on and that we had challenges with. So data was not being provided in time for consideration on a monthly basis. Data integration, access being challenging. So we received data on memory sticks and hard drives. Yes, we did. We collected data at various places, like in parking areas. So wherever we could get the data from on these memory sticks is what happened. Understanding the requirements and the data sets were very, very important. That's a lesson that we've learned. There are different data sets that can address different actions and different requirements that you might have. Data architecture differs amongst all of the departments. There's not a common identifiers, common data architecture. We struggled in some of the departments with common identifiers, customer experience and concerns. So the customers had had concerns around their data, they would say to us, but why are you indicating that I'm on the IRP5 because I have not worked for the last X amount of months, which is, let's say, 8 months or 12 months or whatever. The same with UIF, I don't qualify, but you are indicating that I do qualify in as far as so with a number of these, we had the concerns that were coming through from our customers. So they were doubting the correctness of the data, and then not addressing SASSA's needs from the onset. So there were a couple of times where we asked data, we received the data in time, but then when we looked at the data, it did not really address the need that we had for it in terms of saying that somebody is not employed or does not qualify for any benefit. This slide is also there from the previous time. It just highlights some of the challenges we had. I'm not going to go through the slide at the moment. It is there for in the presentation if you want to look at it a bit later. So if we go back to this picture, and the question is now, how do we change this picture? And especially in terms of what we've learned from the SRD experience that we've had. So when we look at addressing information governance, trust, and cooperation, I think that is the basic element that you first have to have in place. Agreements to be developed and implemented between the different parties that wants to engage on data exchange. There must be a willingness to share and an ability to share the data. I think there were quite a number of departments that indicated, but our data is extremely sensitive and cannot be shared with SASSA. So you have that, and the question is, what is your common goal as government, and what data is then deemed to be too sensitive to share information on, even if you don't share the data? We need to look at the alignment of policies relating to privacy, information security, data use, technical standards. All of those things are important things that we need to look at. So you can have a willingness to share the data, but if your policies and your privacy standards, etc., is not standardized and aligned, then you will also run into challenges. Then I think ultimately, and we've mentioned it, a couple of our speakers also mentioned it today, is the value creation for the citizen. So there must be trust between these organizations in terms of what we use the data for. There must be trust between the organizations and the citizen, so that additional value can, for instance, be created. If we look at the social grants recipients, they also qualify for some indigent services at municipal levels. And I think Nala also spoke to the subsidization programs that they have and the importance thereof. So citizens actually have a spillover into other services that they can qualify for and benefit for. And then it becomes very, very important that we address this need across all of the different organizations, and that everybody understands the importance of this. We need to ensure data standards, looking at a common, at how we collect our data to start off with. I think we've spoken about the digital identity for the citizen. I think Chris also mentioned how important this is, and that this is definitely something we need to look forward to. I think most of the departments that we have interfaced with, we had the Home Affairs identity number as your common identifier, and it was easy to interface. However, there were here and there a couple of the organizations that we had some challenges with. So one needs to look at also, when you collect the data, the standardization of fields as far as possible, so that when we as organizations, when you collect the data, that you look at standardizing the regions and the spelling of it, etc., and then also see how far we can drill down in terms of address data in a standardized way, so that when you have to share data, then it becomes easier between departments, and you have a less need to share data, for instance, address data, because you know your data would be correct. We also need to move away from proprietary data standards towards interoperable ecosystems. I think Georgina hit the nail there, where she said architecture must be created to serve the citizen and to create value for the citizen. I cannot agree more with that statement. Align privacy rules of organizations. It's important that the data to benefit government, the citizen, even if it's sensitive data, how do we make sure that we have that? What SASSA has done is we've worked with quite a number of the organizations to look at developing a declaration and consent form that the client actually signs to say that, you know what, you can share my data, you can share my banking data, you can share my data from SARS and from all of the other organizations. So that's basically how we dealt with that. We also then had an alignment of the newest and latest POPIA requirements in this regard. So your customer consent is absolutely key in this environment. When we look at increase and ensure client matching capabilities, I think we've already spoken to the common identifier, and Anna took it a bit further when she also mentioned biometrics as an added benefit and how we could leverage that to look at making sure that we have common identifiers in South Africa, and you know what, instead of certain organizations using an internal case number, that we actually are able to then move towards a digital identity. I think Fanie also mentioned that we should look at how we reach the households in South Africa, because I think that is quite a gap that we still have in South Africa in terms of our identity of our citizens there. We need to maybe consider additional matching capabilities that we have. The date of birth and the gender we can pick up from the ID, but we could possibly also in the future look at things like the cell phone numbers, especially if we start looking more into mobile payments and how we make those payments, as well as geolocations, etc. Then when we look at meeting the mutual requirements for data exchange, ensuring that there's a full understanding and alignment of the data itself and specifically the requirements. So what I mean with this is when you are interfacing with another organization's data, it's very important that you are extremely clear of what you need from that organization so that they can advise you on the best data set that they can have to address your needs. It doesn't help you go to an organization and say, I want all your data, I want this and this, I want the identity number, and I want to know if somebody is going to receive any money from you, and you give them what you think you need. It would be better to say, this is what I need to achieve, and then that organization can then advise you on what best data sets they have available that you can interface with. When we look at the need to also address financial concerns that we have, and especially investment costs, if we look at those railway lines, I think there are quite a number of departments that still have challenges. As I've indicated, we received data on memory sticks and external hard drives, which is obviously not desirable. We have, however, made quite some progress with these organizations, and I can now attest to the fact that it's not needed anymore. So we have ensured that they are now system and interfaces between us as organizations. Sheirin also spoke to the whole ecosystem and all the aspects that's required for this ecosystem, that it's not just around the sharing of data. And in this sense, I think it's also important that we look at how we address the high availability of the different systems, that all of the organizations look at their business continuity, because it's not just now for your organization anymore. There might be other organizations that are extremely dependent on your data. So you can't just be off for a weekend because you are looking at something or you're needing to upgrade systems, etc. So I think that becomes really, really crucial. We are able to leverage from internal government efficiencies, and I think that's maybe something we must lean on more as government and look towards that. Then what from a SASSA perspective, there are two basic models that you can look at. You can look at having one central hub where you put all the data in. So all the government organizations and other organizations provide their data to the single hub, and then the hub will provide the data to whoever needs to integrate with that. That is one model that you can certainly look at. The challenge that we have with that, and I think that's the model that they've also looked or used in Egypt. The challenge one has with that is the fact that you then are duplicating and replicating data and also resources and effort. So it's another organization or another set of resources that needs to look at holding the data, looking at the privacy around the data, making sure that they've got the data and then that they replicate it. Once you do that, you also have some challenges around making sure that you have the latest data available, and how you make sure that it's always available in terms of the latest format, especially if I look, for instance, we are very dependent on Home Affairs in terms of people that might have passed away, so that we don't make those payments to those citizens. Alignment of timing issues, if it doesn't come directly from source, that's the important thing. Also alignment with the POPIA requirements, only keeping minimal and crucial information for the intended purpose. I think that is very, very important. So ideally what we would recommend is that we explore implementation of web services between different organizations, where we more have a confirmation of data than obtaining the data itself. And a case study and point here is the interface between SASSA and SARS, where we send SARS identifier, and they then just respond with a yes or no, so against their databases. So we don't receive any data from SARS. There's no need for us to store the data to make more space for those data. We just in the end store the response that we have received from them, and once we if there's a need further on or in future for, let's say, court cases or any other cases that might follow, you will then just be able to use that specific data to take yourself forward. That is the end of the presentation, and how we as SASSA looked at the SRD in terms of data interoperability and how we made use of that. So Kathy, yeah, back to you.
Thanks so much, Karen. Just there's a question from Anthony. He's basically asking what can be the lessons from the 2 phases on implementation of the SRD 350 grant that was introduced in 2020 compared to 2021. And specifically, he says, did the entity continue to face the same challenges, or were there improvements?
Yeah, I think 2020 kicked off at a very high speed. At that stage, the time for us to actually put a lot of these things in place was very, very, very limited, and it led to some challenges and errors in payment in terms of the databases being late, so you considered at a different period, etc. And I'm glad to say that we have been able to resolve most of the challenges that we had from the 2020 kickoff. In terms of where we are now in 2021, as I've indicated, there are more secure and interfaces between us and the government departments. We also had time to make sure that we address the requirements of SASSA and the need for data in terms of SASSA. Here and there, we still have some challenges. We are actively taking those up with the different organizations, but there are challenges. It's not like there's a magic wand and all of a sudden there are no challenges. So we are busy addressing those challenges. We also found, for instance, that when we look at the data that is provided to the AGSA and the data that's provided to SASSA is not necessarily the same data, but AGSA measures us against the data that they receive, which is then becoming problematic for us, because they could then indicate that you should not have paid this client. And I think we're all aware of the findings that they brought out. However, now when we go back to the organizations and we say these are the findings from the AGSA, there are quite a number of those findings where, for instance, DPSA are indicating to us, no, SASSA, you made the right decision. So the question is now, what data did AGSA consider versus what we considered? So these type of questions remain, and it remains something that we need to clarify, but it's a lot better than what it was initially.
Super, thanks so much, Karen. I'm going to introduce you to Ahmed Fatih or Takaya. He's actually a senior social protection specialist at the World Bank and will be presenting the case for Turkey. He's got extensive experience having worked on the design and development of Turkey's integrated social assistance system. Fatih, over to you.
Thank you,
Great, and
Katia.
you can see it. Perfect.
I hope you can see the presentation and hear me clearly.
Perfect,
All right.
perfect.
So I'm really sorry that I missed the earlier discussions. I'm sure they are quite productive. So what I'm trying to do today is I'm going to explain the Turkey's integrated social assistance information system. So here I represent as a World Bank employee, but actually I worked in Turkish government over 12 years. And I worked in the design and development of the system, as well as also the design and implementation of several social safety net programs. So it's going to be a sharing of experience from one implementer to you. So let me just quickly start with the presentation. But before going into the details of the system, I believe I need to spend a few minutes on the foundational ID system and the address system of Turkey, which is like a key to interoperability. So I would say Turkey has a very long tradition in the civil registration. It even dates back to the first population census, even it dates back to the hard copies of the Ottoman Empire. But starting from 1990s, Turkey has undertaken a huge project, digitize all paper-based records and assign unique ID number. Even to individuals who have deceased almost like 1850s, they have unique national ID numbers. And after 2006, our statistical authority has done something else. Actually, we moved a national address registration. So they hired almost 30,000 people. And they went over the country door by door, and they registered address system and linked each individual national ID with a unique address code. And that address actually goes up to the dwelling level. All public institutions and most of the banks and national and organizations, they are actually linked to the address system and also the ID system. So there is a huge web service which works between these two organizations. The second point I just want to mention, just to give you a little bit of background on how the implementation on social safety net programs work in Turkey. So at the top, we have Ministry of Family and Social Policies. It's the roof institution for social assistance programs, social care services, but also employment services. There is a fund board, which is Social Assistance and Solidarity Foundation, which is basically the funding authority of the social safety net programs. General Directorate of Social Assistance, here you see it here. It's the execution body of the fund board, and they're basically responsible for the design and also implementation of the programs. But the implementation is on the ground, done through 1,000 local social assistance and solidarity foundations. I used to work in General Directorate of Social Assistance, so I worked in the design and also the regulations, the system, and several other things. So it's a bit different. These foundations are not like ministries' local offices, they are autonomous, but they have to comply with the decisions of the Social Assistance and Solidarity Fund Board. So there are over 1,000 units and more than 10,000 people working in these offices, and half of them are actually social workers. So just to give you a little bit of background about the system, because of the COVID response program, the number of households registered to the system increased to 15 million, and there are over 60 million individuals in the system. So what does it look like before the Turkey's integrated social assistance information systems? You know, I mentioned about 1,000 units. So these are autonomous units. They have their own decision bodies. So you may consider 1,000 different operations in the implementation of social safety net program. Just to benefit from any program, you have to bring so many documents, starting with the ID, social records, social security records, income records, welfare records. So you need to visit different organizations, collect data just to start the application. And there was no link between these 1,000 units. So you may consider as an applicant from your perspective, it used to take almost 15 to 20 minutes in order to just to do the application. So there are like fragmented programs. Individuals can benefit from multiple programs at the same time, and also individuals can benefit from different foundations at the same time. Since there is no system, there was no system at the time. So the whole process was like the fully paper-based approach. So what happened with the ISA? So what do we mean by that? Actually, integrated social assistance information system is an social protection information system that allows the core functions of social protection delivery chain. That starts with an assessment. It includes a social registry, which supports the functions of intake and registration, assessments of needs and conditions, and eligibility. It pulls data from administrative resources, which I'm going to talk about more in the following minutes. But it also complements this administrative data through field visits by social workers, and they all feed into enrollment and eligibility decision. So the administrative data, together with the household visits, they feed into two eligibility assessment approach. One is approximate means testing, which is for the social safety net programs. The other one is a hybrid means testing for the eligibility assessment in the universal health coverage program. So there's a universal health coverage program in Turkey. So the system actually starts with an assessment, then it moves into enrollment. And the final point is the provision of the services and benefits. So there is an integrated payment module, there is an integrated CRM, and also linkages to employment services. So Turkey's system, Turkey's ISIS, is linked with 24 public authorities, and there are over 120 web services works to retrieve the administrative data, which is complemented by a household visit, which is a common form for all social safety net programs. So we have to simplify the process, and we have to come up with a common form for all social safety net programs. So there are no separate forms for separate programs. And there are over 50 different programs running through the same gateway, and some of which have different payment periods, but systems that dynamic that allows you to create different payment lists for different programs. And there's a recurrent beneficiary monitoring. Why do I say recurrent? I'm going to talk about it in the following slides when we talk about the overall process on the application until receiving the benefits. So what are the information that is collected from different organizations, from Ministry of Interior, Civil Registration, Data ID, name, gender, and several others, from Social Security Institution, employment status, wage, salary, from public employment services, unemployment insurance, and the list goes on like that. I'm not going to go one by one. I'm sure you will be able to access this information. But what I'm trying to say is that the system is linked with 24 public institutions. And in order to update the full data, there's a batch job which works during the nights, and it updates the whole database. I'm talking about 60 million individuals data, which is updated less than in half day from these interlinked organizations, thanks to the 120 web services, which works asymmetrically. Before each payment cycle, different programs require data updates, but as a whole, the whole system is updated once in every 45 days from these interlinked organizations. As I mentioned, the first part is the admin data collection part. The second part is the household visits. So once you do a register, then a social worker visits you and using a common questionnaire, which includes almost like 53 questions. But luckily, due to the web services that works, more than, let's say, 40% of these questions can be pre-filled using the administrative data. And this household visits usually is done through once or twice a year, depending on the workload of the foundation. So what happens after data updates? There are over 50 different social safety programs that I mentioned. So for instance, we have conditional cash transfer program, which has two components, education and health. And as you know, the CCT programs require conditionality monitoring. For instance, in order to benefit from the education benefits, your kid needs to have a certain attendance rate to education institutions. Or if you benefit from the health component of this CCT program, then you need to comply with the vaccination schedule that is implemented by Ministry of Health. So the system automatically pulls this data from these interlinked organizations, and at the end of the day, either people stay beneficiary because they comply with the rules. Sometimes they exit from the program because during these data updates, the system might capture that you have an income, which leads to an ineligibility. Or the system might require a household visit, trigger a household visit, because sometimes you are not sure about any detected item might lead or may not lead to an ineligibility. So social work needs to make household visits. And the final process is it automatically initiates a recertification process. It's a recurrent process. So it's due to the strong interoperability framework of the ISAS, this can be done fairly quickly. So how does the process work? As a citizen, you simply make a visit to one of the local foundations. You just provide your national ID number, and that's it. The system first links to national ID system. Then from that, it links to national address system. And from the national address system, it populates every household members who are exactly living under the same roof because you have a unique address code. Then it creates a household roster. Names, IDs, surnames, gender, few other information are collected. So it creates a household roster. Then that household roster automatically fills in the ISA's administrative data pooling operation. So from these 24 linked organizations, your data is pulled from. By the way, this process only takes 8 to 10 seconds. So once you do the application, within 8 to 10 seconds, your household profile will be created. This is like an initial screening because in order to benefit from these programs, you have to satisfy certain income conditions. And due to this data collection, if your income is above a certain threshold, you are automatically ineligible. So if you pass the initial screening, then the social worker makes a household visit, collects the remaining information through the household visit questionnaire, and all these information, collected data plus admin data, they feed into PMT or HMT, depending on the program that we applied. It's a fairly simple process. Then what happens? The board of trustees, which are the decision body of these foundations, they make a decision about eligibility. And depending on the program, you basically pass to the payment list. Before each payment takes place, the system automatically does this data collection again because due to application and the decision, there might be few changes in the admin data. For instance, there might be a new household member or someone might die within the household. So this needs to be updated before each payment cycle. So once you pass the eligibility and you are passed to the payment list, then there are a few options for the payment. So you can get the payment through a social assistance card, which I'm going to talk about it more. Or there is an option to get through the ATMs or the bank offices. We don't create, by the way, bank accounts. There is no need because the system can automatically do the payment to the national ID number and it can be authenticated through the payment. And the last option is the payment at home. At certain circumstances, like if there's an elderly or if there's a disabled person, and if this is chosen at the registration site, then the payment authorities, they can actually deliver the cash at home. And the final stage, once the payment is done, there's an interlink with the payment authorities. There's a batch up which works every night, and it gives payment reconciliation information at every night. So it's a continuous process. Let me just give you one example on how we would do as conditionality monitoring, for instance, for CCT program. This is usually a complex program, and in many settings, there is a bit of, let's say, a manual operation. So in order to show that the kid is going to school with a certain attendance rate, there are usual forms at education institutions. So applicants or beneficiaries, sometimes they need to collect this form and bring it to the authority which is responsible for the implementation of the program. However, in Turkey, it's very simple. Sorry. Because there are two big systems. Ministry of Education has its own e-school MIS program where all public and private education institutions are linked. The same goes for Ministry of Health, and Ministry of Health has family medicine information system. All private and public health institutions are linked to that. So just to do conditionality monitoring for education, system simply pulls data from Ministry of Education's database and updates the beneficiary profiles. It takes only a couple of hours to update almost 2 million beneficiary children for the CCT program, which is a quite straightforward process. And the same goes for checking the conditionality monitoring for the health, and system basically links to Ministry of Health family medicine information system and pulls the vaccination tracking data. It's quite straightforward actually. So let me show you some of the beneficiary profiles, just a snapshot of the system. Here you see a summary, and this is an household of 5, obviously. The applicant is actually the wife. She doesn't have, she's not working. She has only health insurance thanks to his husband. His husband is working with the minimum wage. They have a very old car. They have 3 kids, as you can see it here. You can see what I can tell anyway. Here you see the active programs that they're currently benefiting, and here you see the old programs that they benefited. In the right-hand side, you also see a summary assessment of the social worker. He makes an explanation that applicant is working with a minimum salary, they are paying X amount of rent, one of the kids is sick, so they applied for the program XYZ, so it gives an evaluation of this. If I go to the second slide, you will see the admin data which are collected from different organizations. So it shows here the social security records, health records, real estate scores, and this goes on like that. The information that is being collected from administrative resources. It's easily to track. So what about the payment process? How does it work? So as I mentioned, once beneficiary profiles are updated through the admin data and the conditionality compliance is verified, it's basically a payment list is created. So due to regulations of Ministry of Finance, Turkey only uses public banks and also the postal office, which is also a bank. So once the beneficiary profiles are updated, an admin user from the ministry create a payment list. And this payment list, actually the structure of the payment list is agreed with the public banks, but also the postal office. So we exactly know what data to send and they exactly know how to respond to that data. As I said, there are 4 options of cash delivery. The first one is a cash card. It's like a bank card. So there's no fee in terms of using that cash card. You can use it at any ATM. The second option is you can basically visit one of the offices of these banks and you can retrieve the cash. There is no account. You can use ATM through the cardless operation. You can retrieve the money. And the final option is cash at delivery. As I explained, there are like certain conditions like elderly or disabled. And if you choose to do that, the payment authorities, depending on the agreement that we have, they need to do it. At each night, there is a payment reconciliation operation from these payment authorities, and it has to be sent to Turkey's ISAs. So at the end of each day, we know how many people benefited from the program and how many actually retrieve their cash. So we can also see that. Maybe one more thing to mention about data privacy and security. So the database is actually hosted at the ministry's premises. There's a data center there, and it's an active system. But there's also a recovery center, which is hosted at Turkey's e-government center, I would say. So all of these foundations, these 1,000 minutes, they are linked to the system through a virtual private network and through a static IP number. So the information loop between the ministry and also these foundations are encrypted. So if somebody somehow hijacks, they will get no information. There is a user access rules, and each user have a different access to a different side of the system, and they access the system through the 2-factor authentication and OTP devices. The system room is obviously restricted access, and only the admin users can enter the room through the retinal scans, and devices locked in the cabinets and can be opened by only the registered users. So what about the COVID adaptation? So what happens? So since there is already people benefiting from programs, especially the regular type of social safety net program, which is over 2.1 million right now, government decided to start with an immediate response of 1,000 Turkish lira to these already assessed social safety net beneficiaries. The second piece is government decided to cover individuals who are not part of the current social safety net programs, but also like, let's say, up to middle class. But there are all, of course, like ineligible categories who cannot benefit from this COVID-19 response program, like contracted individuals, civil servants, pensioners, people who benefit from unemployment benefits. They are excluded from this program. And this is like a one-time payment. And as far as I know, there are more than 5 million people who benefited from this program. So how did it work? It's very simple. Simply, government created a link to the e-government portal. Any individual who live in Turkey who have an ID can get an e-government username and password and log into the portal. Then simply they register to the system. For this COVID response, there is no household visit, so it's basically relaxed. So simply individuals register to the portal, ISAs pull the data and check ineligible categories, then individuals become simply beneficiary and started receiving the program. It's quite easy, and almost more than actually 5.5 million benefit from this COVID support. So what about the lessons learned? First of all, actually ICES created a standardization in the end-to-end delivery of social safety programs in Turkey. It's exactly the same process across the country, across all social assistance and solidarity foundations. It increased the performance in the benefits and service delivery. From applicants' perspective, it significantly decreased the time to apply for these programs. From government's perspective, actually, there's a significant performance increase in terms of targeting and also eligibility. Before this program, maybe more than 50% of the social safety net transfers are going to top 50% of the population. But after that, almost 80% of the benefits are targeted to bottom 20% of the population. So it created transparency, accountability, and also there is a grievance redressal system. It's like a central system that allowed individuals to access to the system if they have any issues, any problems. So let me stop here and just to mention that more data and information are available in the source book on the Foundations of Social Protection Delivery System, which we have recently published, and I'm happy to respond to any of the questions that you might have. Thank you.
Super, thanks very much, Fatih, and quite interesting just to see the magnitude of it again. So we'd seen a presentation on the system at a high level, but just to see the back end and the data interoperability and sort of the unique address code linked to identity as well, and how much information you can pull up on the household profile is actually quite interesting, and certainly something that SASSA does struggle with. You know, we've struggled in South Africa to actually identify households. I think it's one of our biggest challenges. And also exciting to see a lot of the field work. Just to check, do you actually visit every household once to twice a year that benefit from the program? Or is it sort of in a roster that you would be checked within a period, let's say one visit within 3 years?
So there is a policy on that actually, and it depends on the program. Some of the programs require household visits, like programs who target households, like social safety net programs, they require household visits. But if you don't have a strong interoperable system, then you need to invest more time and effort on the household visit because it's the only way that you will collect data. But if you have a strong system, which has a linkage with the other system, you can do this by administratively, and you can basically decrease the number of household visits because you will be able to capture most of the information that may or may not lead to ineligibility from the administrative resources.
So then essentially the household visits then largely become more, you know, sort of a verification and inspection function just to check the validity of the data in the databases.
It depends actually, you know, in some cases you need to do the proper assessments, and that assessment doesn't necessarily mean that it's a welfare assessment because there are other things. The form that I didn't show the details, but the form also includes questions related to social care. So sometimes you have to do that. So it's a bit of combination because we wanted to combine the household visit, like an integrated case management approach. So that's the idea. That was the idea, I would say.
Perfect. Thanks so much. Are there any questions? I haven't really seen anything and no hands. If not, then I can certainly ask some questions to Harish and to Georgina. Fanie, from your side, and maybe Karen, any questions to Fatih on the Turkish presentation?
I think, let me indicate, Kathy, that the difference here, in our case, our social grants are very much individual based. They are not for households. And as a result, if you look, we have a strong database about individuals in the country. I think I can confirm today with the introduction of the SRD 350 of the 60 million population, 50% of them, we've got their personal data. But we don't have data for household, and it's because we never did any household related work. But I think this presentation is food for thought for the South African government specifically from the lessons we learned with the SRD, with the COVID-19, that maybe outside of this, as government seek to start looking at development of a central database about its citizens and what services they get from which ministry, maybe one of the things in that effort may be to start looking at creation or development of a central household database, which can work either way. Either we provide you the individual details, personal details of a person, and the database confirms the details about the household, or we give, maybe let's assume there'll be a household identifier. With that household identifier, we can get the individuals within that particular database. So I think it is lessons that we're picking up so that at a later stage, we can be able to see what are we able to put together from the different snippets that we got. Thank you.
Karen, from your side, maybe on the means testing. I know you didn't really talk about the means testing. Do you want to maybe say something on that? Some of the work that SASSA has done around it. I know you briefly touched on it before.
Yeah, Kathy, maybe just to start off to say I fully agree with Fanie. If you remember and recall, right in the beginning, we wanted to add some top up to the grants in terms of households, and we were unable to do it at that stage. So that's definitely something we need to look at. In terms of the means testing, this was a study that we've done with the banks, and it actually worked very, very well, where we would, when a client does not qualify because we find him on a database. And as I've indicated, somebody will come back and say, I shouldn't be on the IRP5 database, or I shouldn't be on UIF, etc. And we are not taking any documentation. So we're not taking any proof from the clients. What we did then is we would take the client ID and send it to the banks. And then the banks would, one, confirm to us whether the client has got a bank account with them. And then if the client has a bank account, whether there were any inflows into that bank account in the preceding month. The logic being that if you received money in the preceding month, you would be able to come by in this month. So that's why we looked at the preceding month. And then there were quite a number of those clients that indeed there were no income into their accounts, and we could actually then pay them. So that was a very beneficial exercise that we undertook with the banks in that regard.
Thanks, Karen. I see, Chris, you have a question, and then Alan, you have a question.
Yeah, I do, or really more just an observation for people to think about. I think with what we've got here, and this is one of the great things about this series, we've got now a sharp, I think, contrast between different approaches in different countries to think about. So in India, and I think in, I'm trying to remember which of the other countries talked about a data mapper approach, where you didn't have a big central database, and what you did was you sought to interface existing databases. Bangladesh, I think, but certainly India. And then you've got a couple of countries today that have talked about really working hard to bring that data into the middle and keep it up to date, you know. And that seems to me like a really important, big strategic decision that you can't unmake. You go one way or the other, and then you stick with it for a long time, sort of thing. So if we're thinking about doing something significant in South Africa, that's kind of an early critical decision point. Do we go for some kind of open interface data mapping approach where we leave control of the databases to individual government departments, or do we try and centralize and do that hard work and then get the big benefits that you get if you can do that successfully? It's a really interesting juxtaposition, I think.
Maybe just before you come in, Alan, and I'd like to sort of pick your brain because it's something you said in our last series. Fatih, to you, so we saw that in the Egypt case, I mean, that data is almost held and housed at the central registry. And because they're stitching all the databases together, you would probably identify the criteria as the policy department, social development, or whichever department, and then kind of send it to them with a request to check and verify the information, and then feedback to say which, you know, beneficiaries are deceased. But in Turkey's case, I mean, you rely on these sort of like web-based platforms to ping and test the data. but surely you have some intelligence within your own environment that you're doing, right? And you're obviously collecting a lot of information about households as well, which is then being complemented with the other data sets as well. So maybe some reflections to Chris's point, because Alan Gal, when he presented 2 weeks ago, was like, there's no real need to have all the data housed in one place, just because it becomes very expensive, and you would want to, you know, devolve the responsibilities of maintaining the databases in the various institutions. But I mean, SASSA's biggest challenge when the SRD 350 grant was rolled out, we thought, oh, you know, it's easy to stitch the data together. And we then realized we had a massive amount of exceptions just because databases aren't effectively maintained. And there's a lot of work that had to be done by SASSA to try and clean up that system. So maybe just some reflections on that, and then I'll open up to Alan. And then I'd just like some parting comments from Harish and Georgina as well. And then Anna, but I'll come, and Sheirin. Fanie, over to you.
So it's like a discussions we had in 2009 while we were designing the system. So it's a big question. So what to do? Do you need to have like a one super system, bring everything together? The answer is definitely no. So the point is, how are you going to update your data? So each institution should be responsible for their party. For instance, we are talking about social security institution, and they need to be responsible for keeping their data up to date at the social security institution. If you are talking about employment, the same has to go through the employment agency. If you are talking about the ID system, they need to keep their data up to date. What you need to do is to bring the mechanism to bring data from these institutions, pull data from these institutions. So what we did is we actually met with 24 public entities. We first have workshops. We explain what we are trying to do. Then we meet one by one each of these organizations to understand what they are keeping, to understand their data structure, if they can share data and what's the methodology. Then we design data sharing protocols for each of these institutions. It articulates the way that how the data will be shared, what will be the security, the type of the data, it's all included there. Then it becomes like a standard. So we did the same exercise for each of these 24 public institutions. So what we basically do, we just pull data, and we always rely on administrative data. And if there is something wrong, if it's not up to date, we ask beneficiary or applicant to visit that institution, fix the data. So we don't fix the data for themselves. So that also increases the data quality within these organizations. I see a question about household structure, and this is one of the most critical things. I'm also working in Middle East and North Africa region. We also face similar issues. So most of these systems, they start on individual basis. So, but think about a household, and there is a high income earner within that household. And if you go through an household approach, obviously that household will not be eligible for the program. But if you go at the individual based approach, then many people will be eligible for the programs. So the best way forward is to move to a household approach that will significantly increase the targeting efficiency of your programs. And at the end of the day, you will not end up spending so much money on the high income contents. How to keep the household structure up to date? As I said, Turkey has decided to have an address system, a unique address that goes up the dwelling level. So in that way, it's Ministry of Interior responsibility to keep the data up to date. They have over, I don't know, maybe more than 1,000 offices. So nobody can basically change the data there. If you want to change anything related to the address, then you have to provide valid documents. We just simply pull the address data from that organization. So we don't basically create an address. So just to summarize, there is no, I wouldn't suggest to go with a one big super system. Instead, build your own system, but at the same time, each government organization has to invest in their capacity and their system so that you can pull data. Let me stop here.
Super, that's a great comment. So maybe just some parting comments to Harish, some recommendations on various ways to actually verify information. Just some thoughts on that. I know I'm putting you on the spot.
No, hi, Kathy. And sorry, I was double muted, so it took me some time to kind of unmute. So no, I think, see, in terms of the different ways to kind of authenticate and then also to kind of bring together different information, see, there are different architectures which are evolving. very clearly with all this, if you embed this into the broader e-government and the open government kind of initiative, then this whole government bus architecture and then leaving the data where it is and being able to kind of collate the data as needed on the fly, I think all of those different approaches are also feasible. And I think it's very important to keep in mind how the data will be updated, how it will be kept current. So one can always collate data in one place, but then if the source of data is updated, and then how do you kind of ensure that it is replicated? I think all of those issues will need to be kept in mind. And there is also this general notion in terms of how the data can be protected, in the sense of the people accessing it are able to only use it for the intended purposes, and then not for there's no scope creep on that front. So I think that also is important, of course, cybersecurity, etc., but more specifically in terms of the protection of data and then privacy. Thank you.
Thanks so much. Very briefly, Anna, if you can just give us a sense of, you mentioned non-face-to-face application systems and how biometrics is changing as a result of COVID. If you can give us like the 7-second elevator pitch. I know I'm putting you under pressure.
Oh, wow. Yes, that's a big question, but I'll try to answer it very briefly. So I think with COVID, I think we have seen some, there's some new trends, and I think this is also partly independent of COVID perhaps, but I think in the beginning there was a lot of emphasis often on fingerprint biometrics and the use of fingerprints for authentication, but especially in in-person settings. And I think now where we're thinking of remote authentication, there's been kind of an increasing use of face or kind of selfie authentication, and trying to match the face then to the ID document or match the face to the ID database, and that's an emerging trend. There again, I think there are very important privacy implications in the sense of making, face is something that can be captured from far away without consent, so just making sure that there is really active consent in the way that face verification is being done, and that it's kind of does not become does not raise privacy risks, the use of the face. So I think that's one good takeaway on that. And I think generally also from the Turkish case, we have seen that there is kind of a lot of new investment in terms of eID systems, ID systems for online use, and that there are many different ways to do this. This can be kind of a password, username and password combination. You can leverage SIM cards for eID. You can leverage chips and card readers. That's usually not the most convenient option, but kind of there are many different options to do this, and that's something that can help tremendously with the remote onboarding and remote service delivery.
Super. And then maybe just last question for Georgina as we wrap up. The role between, we heard about public-private institutions or relationships or partnerships in trying to digitize payments. Just briefly, how do you see the role of the private sector in all of this? Is it kind of the approach that Chris had presented, that government sets the frame and then the private sector supports? Or, is there a different model that you could think, or that you've seen that sort of works better?
Thank you, Kathy. I agree with Chris on that the government will be the one setting the frameworks and the rules ultimately, and there is an important role for the government. I'm thinking on which enabling regulations can support the private sector when they're trying to go out and expand and make sure that there is a level playing field to have financial access points as close to beneficiaries and providing the best service for them. I think in this partnership, it is important that there's a business case for payment service providers, that the payment service providers can have incentives to go out to expand the financial access points in the most remote areas in South Africa and provide access in those areas if there is a business case to do so. Otherwise, there might be other ways to reach those beneficiaries. But I would emphasize that this is a partnership and the close collaboration between private and public sector on making sure that the regulatory framework is adequate and enabling. It will only come from that close input and relationship among those stakeholders. So I would encourage to include them in conversations going forward and making sure that they share the vision of what this modern G2P architecture will look like in South Africa.
Super, thanks so much for that. We've got a lot of food for thought as we plan ahead. And with that, I'm actually going to close today's session. Please note that the presentations and the recording will be shared. It will be available on the CBPEP website, which is www.cbpep.org. We will see you in 2 weeks' time. And a very, very heartfelt thank you to all of our speakers, from Julián, Chris Hamilton, Jason Wang from PASA, Fanie and Karen, always, Harish, Sheirin, your work is invaluable here, Georgina, Anna, and thank you very much for joining us today. We really appreciate your time. And hopefully we will be able to, and sorry, Fatih, I forgot to say thank you to you as well. I knew I was missing someone. So a very big thank you to you as well for very, very valuable presentation, and obviously Nala, who's not with us. So thank you for that. We look forward to seeing you in 2 weeks' time. And there we're going to actually look more specifically at the public sector, how we digitize payments in the public sector. We'll look at procurement. We're also going to look at how we sort of address appeals and the beneficiary processes, how we survey beneficiaries, etc. So we really are looking at end-to-end government services in the end. Julián, any words from you, or are we ready to go?
I think you said everything, Kathy. Thank you very much. Thank you to everyone. Have a good
Thanks, everyone. Thank you for joining us. Take care and enjoy your afternoon. Stay safe.
Thank you. Bye-bye.
Thanks very much, Kathy.
Cheers,
Bye,
Chris.
everyone.
Cheers, Fatih. Thank you so much.
Bye-bye.